And to some extent, we like to look at these copy numbers and perhaps predict what type these patients may actually have. So in some cases, we may only know the copy number, and we'd like to know perhaps in the future what severity this patient may have if they were left untreated. In order to predict that, you actually need to know the relative prevalence of these different types in your population. And you can come up with a graph such as this slide right here, showing that typically one copy of SMN2 would most certainly be a type 1, two copies of SMN2 would mostly be a type 1, occasionally a type 2 patient, and you can see that 3 copies and 4 copies tend to be milder. And this, once again, is based on the relative incidence of these different types. And this is also a graph that illustrates the relative prevalence, at least historical prevalence. And you can see that type 1 patients are much less prevalent than type 2 and type 3, but it has the highest incidence. And this accounts for the difference in the mortality of type 1 patients versus type 2 and type 3 patients. Looking at the most severe infantile type 1 patients, you can see that this is a natural history looking at the event-free survival. So that basically is the idea of how long they can survive without the need for permanent ventilation. And what you can see is, at least based on this natural history study, that 50% survival occurs at approximately 10.5 months. And by 20 months, it's about 8%.